Sjogren's is a complex autoimmune disease. Sjogren's affects 4 million people worldwide, and it's actually underdiagnosed because there are variations of this disease that can be missed by doctors. Hi, I'm Dr. Mikey Yu. I'm a board certified integrative rheumatologist, and I see Sjogren's in my clinic every day. And there are signs and symptoms that can be missed at a very early stage if you're not looking for them. So in this video, we're going to be talking about the early warning signs of Sjogren's disease. Did you know that Sjogren's can affect you from head to toe and affect multiple organs of the body? Sjogren's is probably a disease that you haven't heard of before, but you've probably heard of lupus, you've probably heard of rheumatoid arthritis. Well, Sjogren's is another rheumatic autoimmune condition that I treat in my office. Let's go over the early warning signs of Sjogren's, and your doctors could miss it even though it's staring at them right in the face. Early warning sign number 1 is fatigue and brain fog. Because Sjogren's is an inflammatory autoimmune condition, it can present very early on with just brain fog and fatigue. Now that alone isn't good enough for the diagnosis, but you should be aware that it could be an early presenting sign. Now sign number 2 are signs that all doctors and med students learn during medical school, and that is dry eyes and dry mouth. Sjogren's can attack the lacrimal glands and the salivary glands, causing the dry eyes and dry mouth. Oftentimes, doctors are looking for this to diagnose Sjogren's. However, it doesn't always have to present this way. That's why it's so tricky. But typically, yes, patients can have dry eyes and dry mouth. Sign number 3 is joint pain and stiffness. You can get joint pain and stiffness in Sjogren's, and it can look like rheumatoid arthritis and other autoimmune conditions, which makes it so tricky. So if a patient has joint pain by itself, could it be Sjogren's? Possibly, but more likely if it's just joint pain by itself, it's probably related to either rheumatoid arthritis, psoriatic arthritis, or some other arthritic condition. But if you get dry eyes, dry mouth, and arthritis together, you gotta think of Sjogren's. It may not be rheumatoid arthritis or an associated arthritic condition. Now I mentioned dry eyes and dry mouth, but you may be surprised to hear that you can also get dry skin and dry genitalia as well. Patients, they often present with dry skin, but patients don't talk to the doctor about the dry genitalia. So there can be vaginal dryness with Sjogren's, and it can be embarrassing for patients to talk to their doctors about, but that's something that does need to come up with patients and doctors in a conversation because it does affect the quality of life for patients. And one way to combat this is to use lubrication during sexual intercourse, because the vaginal dryness can be very irritating. So if you're experiencing vaginal dryness and some of these other Sjogren's symptoms that I talked about, please bring it up to your doctor because there are ways to get better with this symptom. Now another warning sign of Sjogren's that can be missed easily by doctors, even rheumatologists, is the nervous system. So Sjogren's can attack the nervous system and can cause peripheral neuropathy, where it causes tingling and numbness on the extremities and other parts of the body. But not only that, it can also cause autonomic dysfunction. So the autonomic nervous system controls many different organs of the body. And when the nervous system gets attacked with the autonomic nervous system from Sjogren's, it can cause a fast heart rate and dizziness, especially when standing. Sometimes patients even lying down. Patients can have trouble with sweating. They either sweat too much or too little. The autonomic nervous system also controls your digestion as well. So there can be digestion problems. So the autonomic nervous system controls your fight and flight mode and also the rest and digest mode as well. So some patients will have problems with the nervous system, and it can be overlooked by doctors, even rheumatologists. And it gets especially challenging when the labs called SSA and SSB are negative, but the patient can still have a possibility of Sjogren's. And when they have nervous system problems, especially when the labs are negative, it can be quite tricky. And on another note, the nervous system also affects the bladder. So patients with Sjogren's that have the nervous system affected can get bladder dysfunction, so they can have a problem with urination or retaining too much urine in the bladder because the nervous system just isn't reacting well. So if you've been struggling with a lot of these different symptoms that I've talked about, it is possible that you could have Sjogren's. You definitely want to get the labs SSA and SSB, and also the ANA antibody, also known as an anti-nuclear antibody, to help with diagnosis. And some labs do have something called the early Sjogren's profile, which can potentially contribute to the diagnosis of Sjogren's. So if you like this video and you learned something new, please hit the like button and subscribe button and comment below what you learned and whether it's possible that you have Sjogren's. And if you do have Sjogren's, you can tell me what symptoms you've experienced from this video. And if you want to see me in my clinic where I treat Sjogren's, you can find me at drlifestyle.org, and you can go to my website, myautoimmunemd.com, to listen to my podcast, take some courses, and get some more education on autoimmune conditions and chronic illnesses. I'll see you guys next time.